Tips from the ER. COVID test. Where should you go to get a COVID test? You should go anywhere but the emergency room. That's right, motherfuckers! Stop coming to the ER for a routine COVID test. The ER is a COVID-infested hotspot. There are drive-through testing centers. You won't even have to get out of your car. You can even have someone come to your house and swab you so you can stay the fuck at home. Employers, if you require your employees to get a COVID test for work, then it is your motherfucking job to safely get them a test. Having them come to the ER is lazy and irresponsible. So please, get off your lazy asses and do some research. Tips from the ER. Hallway beds. Did you know that your ERs are using hallway beds to treat patients? How dare they put you in a hallway? Fun facts, motherfuckers! This is perfectly fucking normal. The ER was never meant to see every paper cut and bruised lip that's ever happened to you, but you came anyways. Add to that the surging number of COVID patients, and you can guarantee your ass will be sitting in the hallway exposed to all the fun little bodily fluids and germs we get to experience every day. I know there's no privacy. I know the patient sitting in the bed next to you is drunk, half asleep, and peeing on himself. Trust me, I'd rather you not be in the hallway awkwardly staring at me while I look up one-way tickets to Canada, but we can't seem to figure out how this works. So let's just suffer together. At least you're out of the waiting room. Tips from the ER. Appointments. Can I make an appointment? How long is the wait? Are you busy? I don't want to be here too long. But my doctor called ahead and said there's a bed waiting for me. Surprise, motherfuckers! Your shitty doctor lied to you. Calling ahead does not mean you get to be moved to the front of the line. We see the sickest patients first. We cannot time people's emergencies. We have no idea whether or not it will be busy by the time you get here. Emergencies happen fast and randomly. You really want to know when release busy? 3:30 to 5. In the fucking morning. That's your window. Anything outside of that, be prepared to stay with us 4 to 5 lovely hours. Tips from the ER. Pediatrics. Parents, when coming into the ER with your child, please, for the love of God, stay calm. Stay motherfucking calm. I know the ER is a scary place, but your child is looking to you for reassurance. If you freak out, they will definitely freak the fuck out. Their anxiety is already through the roof just being at the hospital. Fear of what is going to happen to them is usually worse than what is actually happening to them. If you need to step out of the room, we will not think any less of you for it. We actually encourage it. If it'll help us do our job, please, get the fuck out! I mean that in the nicest way possible. Have a good day. Tips from the ER. Private rooms. If you come to the ER with premium health insurance or pay extra in cash, you can get a private room in the ER. Psych, motherfuckers! Offering to pay extra will not get you a private room. $800 health insurance? You're getting the same doctors, nurses, and treatment as someone without insurance. Surprise! There is no hierarchy here. We're all on the same level. Where does Barack Obama go when he comes to the ER? The same bed as you. Right next to some COVID patients, because you can bet your cute little ass we're in a fucking pandemic. Tips from the ER. Chest pains. If you are 35 or younger and you are experiencing chest pains, it's most likely not a heart attack. Now, I'm not saying it can't happen. If you smoke a pack of cigarettes every day starting at 18, yeah, you'll probably have a heart attack, motherfucker. But if this isn't you, because you're a smart motherfucker, then it's more likely one of these 3 things. Number 1, stress and anxiety, which is easy to understand given the fucked up year we've had. Reason number 2, you pulled the muscle. It needs rest, maybe some ice. And my favorite, reason number 3, you smoke too much weed. Lay off the ganja, it's freaking you out. If you've had chest pains from any one of these 3 things, comment below. Tell me I'm right, it wasn't a heart attack. If you've had a heart attack before 35, that's wild. Comment below, let's learn about it. Tips from the ER. Things not to ask us when you come to the emergency room. Was this bed used for COVID patients? No, of course not. We unboxed a brand new $6,000 ER stretcher just for you. As soon as I saw you check in, I called downstairs and said, hey, Joey, bring up one of those new beds for my girl Karen here. Her ass only sits on COVID-free furniture. Of course those beds were used for COVID patients, motherfucker. What do you think this is? Not a pandemic? You don't want to sit on COVID beds? Stop doing crazy shit like sticking vegetables up your butt. This is not the time for a carrot to accidentally get past your sphincter. We don't got time for this shit. Behave so you can stay the fuck at home. Tips from the ER. Cover your nose. Did you know that the nasal COVID swab is nearly 100% effective in detecting COVID? That's because those fuckers live up there. What do you people not understand? What's your thought process? Half protection is better than no protection? Cause you would be wrong, motherfucker. That's like a cop asking for a bulletproof vest, but only from the belly down. If I put the vest around my chest, my lungs can't expand and it makes it hard for me to breathe. Just protect my belly. Sure, you won't die from getting shot in the stomach, but a bullet to the chest certainly can kill you. But hey, I get it. If you think being told to cover your nose somehow infringes on your rights as a human being, then fuck it. Take the mask off. It's your choice, and I'm pro-choice. But remember, this virus can easily infect and kill those around you even if you feel fine. So how about for once in your life, you think about someone other than yourself? Put the damn mask on. Tips from the ER. IVs. And no, I'm not talking about your indestructible vagina syndrome. People, when you come into the ER and you get an IV, we know it could be uncomfortable. We stabbed your arm with a needle and now there's a tiny little micro straw sticking out of your vein. We get it, it hurts. But that IV is one of the most beautiful things we can give you. Think about it. It is a motherfucking miracle that we could shoot drugs directly into your bloodstream to save your life. We don't take it out until the second you are discharged because, God forbid anything happens to you, that little thing will be the reason you get relief. Stop asking us to take it out. We have patients who try to sneak out of the ER with it in because it is so valuable. That IV is your first class ticket to the best narcotics science has to offer, and you're complaining because it hurts to bend your arm? Why did you even come here? Tips from the ER. Urine samples. People, listen to me. When we asked you for a urine sample, we are not trying to get you in trouble. Our priority is not to send you to jail. Our priority is to make sure you don't die. We need to know what is in your system in order to take care of you. In particular, if you have abdominal pain, the test will tell us whether or not it is a UTI, which it probably is. Stop lying to us about what drugs you've taken. We could tell. How? Because this is our job. We see this shit every day, 24/7. If it's meth, we have to hydrate you. If it's cocaine, we have to make sure your heart doesn't explode. If it's THC, we will leave you the fuck alone. Maybe get you a snack. If we suspect that you are drunk and you tell us you've had 1 drink, we assume 3. You say 2, we say 6. We multiply by 3 because you motherfuckers are liars. It makes our job so much harder and it puts you at risk. Why do you hate yourself? Learn to work with us so we can get you the fuck out of the ER, which, trust me, is what we all want.